Eh? Okay. Tata? Yeah. Can you colleagues see me? Can you talk so that I can hear you? Because I'm talking via the stream itself.
Remember, there's going to be a 30-second delay, Chief. Remember about the delay.
The cost of delay. Hey. Kubani ombonayo? Yebo. Uyangizwa? Yebo, uyangibona. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Hello? Yes, Tata. But i-audio iphansi. Mana nginjani Tata?
Okay.
Yeah. Oh, okay. Mana-ke, Tata uyangizwa? Oh, isiphezulu kakhulu manje. Isinjani manje? Esaphezulu bacela usise kancane.
Sengehlise izodelay. 1 2 1 2 1 2 1 2 cela uphinde umkhulumele futhi mkhulu. Izodelay ngo 30 seconds.
Okay, Nhlanhla ibidelay ngo 30 seconds sinjani manje? Yeah, Mohammed.
Yes, sir.
Yes, Mohammed. Mohammed, can you hear me?
Yes, I can hear you.
Sorry? No, we're fine. Yeah. Ndiyayifuna nini? Manje ngizokuba umsindi. Yebo. Bathi icela uyikhuphule kancane isalo.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Lo muntu obalayo lo. Cha ngiyabala mana wena testa ngamathi uPrime uzobekhuluma from here. So wena bala ibala testa mina njengoba ngikhuluma nje check mina njengoba ngikhuluma ukuthi uzoba kanjani. Abathule bakhuluma emva kwemic ne?
No. I'm saying no the tester from behind the mic. That is the speaker out. So we like people test out. The mic is directional.
Okay, testa mina ke ngoba no Premier uzobekhuluma kanje ngoba ngikhuluma.
Okay.
Ngibale.
Ngicela ungibalela kodwa.
1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20.
Makazi.
Yebo.
Ngicela bayinyuse by 6 GB.
Banyuse ngo3 bani?
6 GB.
6 GB. Isound. Uthi it should be fine now.
Okay, ngizoyilalela ngizobonisa ngicela ukhuluma.
1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20. Ubani lo ngithethisayo uthi ngibali? Hey, the dog, how are you, the dog? Hey, the dog, hayi sekuzoqonda ke mase kufike odokotela hayi be COVID, odokotela be technology. Yebo ntata. Yebo ntata. Ngoba bacela uyibuyise le volume level athi uyibeke kuyona earlier on. Bazoyinyusa bona on their side.
Ngoyehlisa mina.
Bazoyehlisa bona on their side. Bacela uyibuyise le volume ade beyibeke kuyona eqaleni.
Iyona le ngiyibuyisele kuyona.
Ubeke ku-order ngathi ufake ku-order.
Khona le iphezulu khona.
Khona lathi iphezulu khona.
Oh, ufuna lokhu njani?
Ebongzini usebenza noDasen unoDasen namhlanje uyena osebenza uyasaba ukuza uyasaba unjengoSimphiwe Makhanya uyasaba usabe ilokuzana kanti siyasanitizer la dog siyasanitizer dog skala sithi kanje. Yes, hello. Hello.
Mr. Mabaso.
Hello, sir. Hello, can you hear me?
Yeah, I can hear you. I'm just saying, remember we are already streaming live, huh? So I think maybe we need to just confirm with SABC and then cut the stream and maybe even the
I know it's fine. I'm just chatting and having fun with my colleagues there.
I can see that. Premier in waiting, I told you.
No. I think we are. There's something called spin doctors overreach.
All right, so.
It's not only judicial that will have an overreach. Spin doctors can have their own overreach. Yeah.
No, but anyway, we're good to go. So I'm gonna cut it here.
No, don't cut until Tata confirms. You can't cut.
No, only the call with you.
Yes, Tata. Say you see. 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 Yeah.
Uthini mfethu?
Uthi volume saselo.
Hayi nhlanhla. Ngizotshela undaba.
Ungcobo nangu ungcobo uthinta la ufuna uthinte khona. Ngoba nangu kubiza inhlanhla. Ngobo, nangu tate kubiza.
Ntanta. Lenzani iqadi? Qadi. Ntanta. Bafo ngeke silungise lento bafo fast. Kwenzakalani lapho? Ubani lo lapho kule machine nawe lapho? All right. Injani manje?
Abale asephingi ngithe
Oh, ngiyayibona inkinga uthi ngenze nje.
and then ilokuzana
Uyamuzwa ya ngilalele bafo.
kanjalo ipitana ikwenza la.
Usele na.
And then la bani unyuzo masuka ngala.
Ngobo. Okay, ngizomcela manje.
One KZN. Umfone. Awu, khona nawo. Namhlanje 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20.
Perfect ngobo.
Oh, idinga ukuthi intanta kuze kufike ungcobo awungangezwa mina.
Fase simemeza ungcobo.
Fase sibiza ungcobo. Okay, shabu wethu. Uyangizwa Simphiwe? Okay, ngicela bangisendele ama questions, bangithumele ama questions, babe wathumela ama questions. WhatsApp. Bongani. Ngicela bathumele ama questions abantu ku WhatsApp. Banikeze ne live stream Mohammed, ufake live stream lesika Mohammed usithumele ku group yonke. Mohammed, can you send Bongani the live stream so that he can circulate to other colleagues in the media? And to the provincial heads of communication, can you also say, you don't have the WhatsApp group, send it to me so I can also circulate it to them.
Yeah, I'm sending it right now.
Okay, sure. So I can cut here, colleagues, you are sorted. Dada? Yeah, when we cross, when I'm facilitating, we last week on one side, was about to miss around. Yes, I'm for it. So connect. Hey, young Sagwa. That's Sagwa's the. If he looks like, oh, it's 10 o'clock. Oh, I beg it. You are with it. Try come now.
No, you
Eh?
Ngasithanga wena Duma ungayibeka.
Beka la ngithi ngikhonela lokho ukuthi ngibeke ngizokususa ngikususa lokho mafuna ngikususa.
Kodwa hey. Nalesithembi sikaDuma.
Sirathi kakhulu bese iprofile.
Asho njalo vele uMahlathi. Akuthi uyabona uma sihleli la buka la Duma. Yabo buka la Duma. Duma. Duma buka. Amahlelo mabaso uyabo nasi sikanje. Kodwa yabona mangabe kuhlela umabaso sekungena le mic kaDuma engazi
Isiyodwa.
buka ke mase kuhleli
Cha so uzoyilokho uzo.
Izojayekisa.
uMahlathi is not 2 hours namhlanje ebusuku
Ubani?
Ngayiseva nithi bedroom part 1 manje.
Ngo-president.
no sir current affairs
Mphathi. Sengacisha la
Wena bani?
si I mean 702 so simbali
So as ama reporters,
yeah it's not 2 hours
where you do an analysis.
basically you extend isitori sakho ubiza abantu chama interview basically they're training us to be anchor
Also so an kana. You can use my studio that I'm acquiring here in Devon.
Any podcast?
I'm doing a studio. I'm trying to secure a studio at SABC. Well, I forgot we East Coast Radio con. Let us do that. See, empty seven within a sleaze.
Sithathe.
Ngenza zonke into zika government ikusona.
Sithathe.
Mangivula i-radio station i-KZN government mangizolinka nje i-show yethu ngivele ngiyilinke from there yabo ngishaye khona i-show ukuthi i-hour likahulumeni every MEC weya lapha ngiyilinke laphana angithi ndani I'm doing it ayisebenzi 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 yabona welokuzana
Ndiyayicisha le mphathi. Save ibheke.
hayi kulungile
sondela.
Okay, let's.
Hayi,
Ngeke
ayisekho.
ngicela yini ngasiza udadewethu lapha ngihlale ngapha.
Hayi. Ya ngeke.
But there's no social distancing here. I need to sit here. The lectures here to be there.
Impela uzodinga Thanks, colleagues and all members of the media, MEC, Ms. Nomagugu Smelane Zulu, MEC for Health, all officials from various departments who are with us, the colleagues who are following us from various platforms. We extend our greetings to all of you, ladies and gentlemen. Let us start by once again thanking you for attending this media briefing, which afford us an opportunity to interact freely, frankly, and openly with you about all matters concerning the invisible enemy that is coronavirus. During especially this challenging period. We appreciate and thank you for always being the eyes and ears of the people and for being such a vital link between us and the public that we serve, even at a challenging time like this. Equally, we are concerned by recent reports of instability within the media fraternity, which has seen a few media outlets being forced to close shops or to retrench employees as the economic impact of COVID-19 continues to take its toll. Retrenchments and closure of newspaper and magazine titles are always disturbing and a heavy blow to our public discourse as a country, because a thriving, vibrant, and patriotic media establishment is vital to a strong democracy. The media is, after all, a nation talking to itself, so we cannot afford for this all-important discourse to come to an end. Let's take this opportunity to pay our tribute to the Command Council and all officials working with the Command Council. We want to thank members of our Provincial Command Council and a number of officials and support staff for dedication and hard work that they are putting in on a daily basis. There is a lot of hard work that is being done away from the glare of the public. The virtual meetings, data analysis, compiling of reports, and scenario planning that goes on late into the night, all in an effort to ensure that we as government are always adequately prepared for COVID-19. We are also thankful to our many benefactors who are always approaching us, looking for ways to contribute and help us win this war. We will soon be making a public announcement in this regard. We urge others to look within and ask themselves how can they contribute, for we can never have too much assistance to be ready to face the challenge that is confronting us. Let us take this opportunity to reflect on the past week. Compatriots, we have come from a difficult week in which we lost 98 compatriots who succumbed to COVID-19 related complications. As KwaZulu-Natal, we are still licking our wounds following the untimely demise of Queen Noloyiso Sandile, the daughter of our revered King Cyprian Kadinizulu, and a sister to His Majesty the King. We wish to extend our message of condolences to His Majesty and the Royal House as a whole. We also lost a member of the Provincial Legislature and ANC Provincial spokesperson, Comrade Ricardo Mthembu. The demise of our fellow citizens comes as we saw a sustained exponential growth in the COVID-19 cases and fatalities in the province, as well as in the country as a whole. As the provincial government, we share the pain that is shared by all the families that have lost their loved ones. With the passing of each day, we are increasingly being catapulted from being in the eyes of the storm toward being firmly entrenched in the middle of a raging and violent hurricane. But this is not time to lose the war. This is not time to feel demoralized or to succumb to despair. We need to wage a relentless fight against this invisible enemy. And waging this fight requires everyone to do what they are supposed to do, to play their role to stop the current generation from being remembered as a generation that were wiped out, or generations who failed to stop the tidal wave of this invisible enemy. It is now time to put our boots on and get into the war. The eyes of the deadly departed must open the eyes of the living. Responsible behavior has to start with you and I, and that must happen today. It is now in our hands to curb the spread of COVID-19 virus. Over the last 7 days, we have noted with concern the number of infections that have been reported after people have attended gatherings such as ceremonies and funerals. In most of these engagements, measures like social distancing and wearing of masks have been disregarded. In the past week, we have been made aware that a sizable group was reported to have attended a wedding last weekend. In the end, a number of people from that wedding felt sick, and 25 from the group who attended the wedding tested positive. Today, some of them are occupying COVID-19 beds in the healthcare facilities. We want to plead with all our fellow citizens to know that COVID-19 spread faster with the gatherings. No one is immune or can be a stirring or the invisible main actor on the COVID-19, as there is no cure. We plead with everyone to adhere to the regulations. If we stay safe today, we can be safe and together tomorrow. Ubumnandi or fun never ends. Ubumnandi apheli bakwethu. Siyacela ukuthi sonke sigweme ukuthi sambele imicimbi la sibabaningi khona singayilandeli futhi imigomo ebekiwe. It has always been there and it will be there in future. When COVID-19 is no longer a problem, people will still entertain themselves. But if we disregard precautions, we may compromise our lives and those we love. COVID-19, umashesha, it is fast to infect and can be deadly. We are once again pleading with our people to be patient and take care of themselves and be responsible. With regard to statistics in the province, as of yesterday, KwaZulu-Natal has had 23,751 positive cases, of which 17,450 are still active, 280 deaths, and 6,021 recoveries. A week ago, we had 13,984 cases, of which 9,605 were active, 182 deaths, and 4,197 recoveries. Therefore, this means that in just a week, in just 1 week, we have had 9,767 new COVID-19 cases. It's a huge number. It is 9,767. Those are new cases. But also, sadly, we have had 98 new deaths and an additional 1,824 recoveries. The province is currently on a surge, recording above 1,000 cases daily. We are still the fourth highest ranking province with a number of laboratory confirmed cases countrywide. However, the province is ranking the third highest in terms of laboratory testing. The province contributed 14% of the new cases reported nationally. Among the 11 districts, eThekwini continues to receive the majority of cases and is accounting for 53% of the total cases provincially. eThekwini and its neighboring districts, district Umgungundlovu, account for 60% of the cases recorded daily. Umgungundlovu district ranked the second highest with COVID-19 cases provincially and has overtaken Ilembe District Council. King Cetshwayo is also one of the districts that have been receiving more cases recently, and the district has been recording a median number of 66 cases a day. That also is a serious number. Amajuba has been also stable, but on the 10th of July, Amajuba district received 111 cases, and the upsurge was due to clusters in the following workplace: Amajuba District Council, as well as SAPS and the Department of Transport. And all of these are in Newcastle. Ilembe has also been stable for the past 6 weeks, but on the 10th of July, the district recorded 133 new cases. Uthukela had a 30% increase in cases within a period of 7 days. The district received a median of 60 cases daily within this period. Umkhanyakude is the only district that has been receiving less than 50 cases daily. The province has observed an increase in the number of COVID-19 patients admitted in both public and private hospitals. Private is admitting right now 73%, which is 933, and public hospitals admitting 27%, which is 377. Of those admitted, 159 patients required intensive care. That is 13% of the admitted patients. Among those who required intensive care, 57% of them were ventilated. Other patients were admitted in high care units. We are noticing an increase in a number of patients admitted in ICU, both in private and public health facilities. With regard to fatalities, eThekwini Metro Municipality has contributed 67.4% of the reported deaths. In terms of numbers, that is 184. The age for deaths is around 62 years, the average age. The male patients continues to dominate the fatalities with 55%, which in specific numbers is 142. Deceased female patients dominate among those aged 81 years and above. KwaZulu-Natal recorded its first pediatric deaths since the beginning of the pandemic. The deceased is a 5-month-old who had been admitted with tuberculosis. The most common recorded comorbidities amongst the deceased include hypertension, 29%, diabetes, 30%. The proportion of HIV-infected deceased patients has also increased, and it is now 22, or in terms of percentage, it's now 8%. The number of deceased with no recorded comorbidities has also increased. There is also an increase in the number of patients that are dying on arrival, as well as home deaths. Distribution of cases and deaths by district in KwaZulu-Natal between the 5th of March and the 11th. We have provided the specific cases there. eThekwini, the deaths are 188, and it is followed by uThukela with 16, Ilembe 15, Umgungundlovu 15, King Cetshwayo 10, Ugu 10, Amajuba 8, Umkhanyakude 6, Herigwala 8, Zululand 2, Umzinyathi 2, and in total we have experienced about 280 deaths. Now, the capacity in our hospitals, as well as field hospital and temporary structures, the growing infections have prompted questions regarding our state of readiness, including our ability to test, admit, and quarantine, as well as to isolate and treat patients. While we have confirmed 7,111 beds, we continue to add more beds through, among others, engaging with private sector hospitals and engagement with the hospitality industry for quarantine beds. We are also erecting field hospitals, with 4 expected to be finished by the end of this month. We expect that the Development Bank of South Africa will also be donating more beds to the province. These increases are adding on what we already have, but added with the possibility also of oxygen flow in the refurbished hospitals and the availability of the drugs that are quite necessary to ensure recovery of our patients. As things stand, there are 17,450 active cases. Out of that number, 1,400 patients are in hospitals. Now, there is a graph which then talks to the detail of analysis of our patients in public facilities. And in terms of the total, we have those that are quarantined, there are 967, and those that are in ICU, there are 24, and those that are ventilated, there are 21 as we talk. Private hospitals or facilities, the total is quarantined is 71, and those who are ventilated, there are 96. With regard to KZN curve dynamics, the medical and scientific team had projected the province to be at more than 200,000 patients by mid-July. We are currently sitting above 23,000 confirmed laboratory cases. This say we are behind the projected figures. We also looked at the projected ICU admissions, which was just above 5,000. And right now we are sitting just above 45 patients in ICU and high care. Our endeavors as government are aimed at reducing the impact of the disease. The rise in infection is worrying us in a big time. A health promotion strategy has been developed and will be implemented with the aim of strengthening knowledge amongst our people. The strategy will be utilizing community healthcare workers as the key pillar in disseminating these messages. Coupled with this strategy will be the assessment of suitability of households for those citizens that will choose self-isolation after testing positive, as well as their monitoring process during the isolation period. We urge our people to be responsible. While the growing rate of infection is a cause for concern, we have not reached a stage where we have run out of space. However, each and every one of our citizens has a responsibility to ensure that we do not get into a point where we run short of our beds. We are closely monitoring these areas while ensuring that in the event of crisis, our contingent plan is ready to kick in. With regard to care and support staff, the rise in infection among the population in general and among the healthcare workers is seriously worrisome. We are continuing to analyze how this is happening, but more importantly, we have already issued guidelines on handling infected healthcare workers and healthcare areas. We have started to engage the labor organizations on this matter. Furthermore, we have taken a decision to re-workshop our staff on PPE use and other precautionary measures to be implemented at individual level and on the shop floor. The process of recruiting nurses, general orderlies, and clerical staff in our healthcare facilities is ongoing. Again, this is another area that we are closely monitoring to ensure that healthcare workers abide by the precautions, that they get all the support they need, and significantly, the healthcare support does not, it should not collapse as we recruit more staff to address the shortage that is there. We have observed disruptions of normal operations due to illegal strike. This is a disturbing trend that we have observed over the past week, where there were more than a dozen illegal strikes at hospitals in various parts of the province. were informed through the media that the process were due to, among other things, a so-called lack of PPE and infections among staff, the deep cleaning of workplaces after staff have tested positive, while in other instances, the strikes had to do with issues concerning the procurement of issues. In some instances, we saw staff locking gates and digging holes to prevent access to these facilities. The most worrying aspect of this protest action is that when you dig deeper, you realize that most of these bones of contention are smoke screens that are being used by people with ulterior motives. They have sought to use the general fear and anxiety brought about by COVID-19 to pursue their own narrow and selfish agendas. You have found instances where issues that have long been resolved between government and organized labor being raised as if they are still new issues. For instance, PPE is not new, but a buzzword that people are throwing around to cause confusion. There hasn't been a shortage of PPEs for months now. We are doing everything in line with the guidelines from the World Health Organization to ensure that PPEs and all necessary material is provided. Similarly, when it comes to deep cleaning of facilities, we have not diverted. We are doing this by the book. We follow the prescript and the regulations. With regard to screening and testing, we have tested and screened over 7 million people in KwaZulu-Natal, and we are intensifying this effort. With regard to our progress on schools, in most schools, the grade 6 and 11 have now also returned to school smoothly. We continue to monitor the infection rate at schools like we do in all other sectors. Schools are part of society and are impacted by the environment. To date, we have 873 cases in KZN schools involving teachers, learners, staff such as gardeners, ground people, and other officials. It is important to note that at this stage, there is no infection that has been contaminated from the school. With regard to the message, we would want to issue a message to all the people of KwaZulu-Natal that each and everyone can play his or her part in fighting this pandemic. At home, on our way to work, at the supermarket, we need to follow these instructions strictly. Firstly, stay at home when you feel unwell. Keep to physical distancing always, and that must be a practice. Let us wash our hands as frequent as possible with soap and water or in an alcohol-based hand sanitizer with no less than 70% alcohol. Avoid crowded areas. If you test positive, inform your employer so that they can take the necessary steps to protect fellow workers and others that comes to your workplace. These are very important rules that we must all follow. We have heard about an ambush of a taxi full of passengers in the province. We wish to register our shock and dismay regarding the cold-blooded, animalistic, point-blank shooting of a mini taxi or a minibus full of passengers in Inanda yesterday. This is one of the incidents which was captured on mobile cell phone videos, resulting in the death and the injury of a number of people. We want to assure the people of KwaZulu-Natal that this case is being investigated, and that we will do everything possible to bring the perpetrators to book. It is unthinkable and barbaric that anyone would deem it proper to open fire on a mode of public transport full of innocent passengers who are merely trying to reach their destination. It is very important that we send our strong message that such violence will not be tolerated at all. We also would like to send, as we conclude, to send our heartfelt condolences to all the families that have lost their loved ones due to COVID-19 and other causes. We ask the Almighty to give them strength at this difficult period. We take joy in the many recoveries that we are recording as the country and the province. I also extend a message of support to my colleagues, the premiers of Gauteng, Northwest and Western Cape, who have tested positive, and we hope that they will recover soon. This pandemic is beginning to cause us scars. However, this is not time to give up. Let us continue to wage the safe battle against COVID-19. Let us continue to protect our fellow compatriots as we also protect ourselves. Let us also change our behavior and fight the stigma. Let us spread facts and not fear about COVID-19, because it is not a death sentence. There are a number of recoveries that we have already received. As we mark the week of 67 minutes dedicated in honor of former President Nelson Mandela, let us commit to changing our behavior. Ultimately, it is our collective action that will count. We want to conclude by sending a strong message that taxi violence that continues in the province will not be tolerated. What happened in Indwetwe will need to be followed with speed. We have, through the MEC for Transport, Community Safety and Liaison, MEC Begintuli, asked the Provincial Taxi Violence Task Team to speedily investigate the latest taxi violence incidents involving taxis from Durban to Umzinyati and the areas of Indwetwe. We will also want to ensure that all the perpetrators are brought to books. I thank you, Program Director.
Thank you very much, Honourable Premier. We'll take the questions. Clarity is back. Mthembu, you're number 1. Sihle, number 2. Zikalala, number 3. Party. And Provincial, that one. And then we'll take the other colleagues. Oh, Karen. Yeah, we'll take the other colleagues on the second part.
Good afternoon, Premier. First and foremost, I'd like to express my sincerest condolences to the Mthembu family and to your colleague on the said passing of Mr. Ricardo Mthembu, our colleague. I would like to start here, Premier. We know that taxis in the province have been loading people at 100% now for at least about 2 weeks, if my memory serves me correctly. Are you not, because the provincial government has not been seen to be acting on this particular matter, except condemning the fact that SANSAP has taken this decision, but what has been happening is that our poorest citizens are still being buried, being squashed in taxis. What are you doing about this? Because clearly this is going to lead to another disaster for the Department of Health, and given the fact that those people will not be able to self-isolate. In regard to the care dynamics, we understand that fine, we have lower numbers than anticipated, but can this not be linked to the fact that you are not testing the number of people that you have desired? In regard to the corruption allegation that involved the Department of Social Development, you had promised an investigation into that matter. There are reports suggesting that that investigation has been concluded by the Provincial Treasury Department, and that report is before you. Can we get an indication of when it will be made public? And just lastly, so we understand that there have been about 8 incidents of protest action or some displeasure being expressed at health institutions. Although you say that these issues that people are raising is smoke screen, clearly there's a problem, and it is affecting our most marginalized citizens, because most of these institutions are public health institutions. When you say that these people are using their narrow agendas, what exactly are those to back that statement, and how then are you addressing them before we reach a crisis?
Umbuzo wami ngibhekise kuNduna uhlonishwa. Ngicela ukubuza ukuthi ungqongqoshe lapha phezulu kulokhuzane kuzwelonke uye waveza ukuthi the storm has arrived, meaning ukuthi igciwane leli ngathi sezogadla kakhulu, and okunye okulandelayo ukuthi kule nyanga le esiya kuyona mid-August kubukakala sengazathi kuzobe kushukile kakhulu. Manje bengicela nalana futhi KZN njengoba kade usinikeza iy'balo, sibonakala silokhu sikhuphuka isibalo sabantu abashonayo kanye nabahanqiwe igciwane. Engicela ukubuza ukuthi kungenzeka mhlampe isifundazwe sibe nendlela yokuthi mhlampe sithi ukuqinisa, ngoba kunokuswelakala ukuthi abantu ngathi sebekhululeke kakhulu, sebebona ngathi le nto le ikude kakhulu nabo. Kungenzeka mhlampe ukuthi uNduna ne-cabinet yakhe bacabanga ukuthi mhlampe bakhe ukuqinisa kancane ithemba.
I'd like to know, please, I know you have touched briefly on the chaos and the class protests at hospitals, but specifically at Edendale in Mthembu, staff members protested raising concerns that more than 22 staff had been infected and that 2 nurses had died, that they were not being tested, and that PPE was of poor quality. Can you give some clarity regarding the issues at that hospital and how you're dealing with them? And secondly, Mahatma Gandhi, according to some board members, has reached capacity on the number of people that can take them. Can you please comment on this?
Thank you. My question is around Umgungu. Umgungu right now it has a lot of challenges in terms of finances. It's basically barely able to function. Now you've mentioned that Umgungu has, when it comes to infections, it's second after eThekwini. So coupled with the lack of resources for Umgungu and the high infection rates, what is the provincial government doing in order to try and ameliorate or make the situation better in that region?
Okay, thank you.
I'm calling from Vibe FM, Kwamash. Bengithi angibheke Premier CEO of Education last week reported ukuthi there were some disturbances between the one PVEs with some circuit ukuthi leyo matter leyo ilandelekile or not. The second one I think goes to MEC about the COVID Relief Center in Chesterfield, where the community, it's like the center is up because the beds are there, and apparently the community is up in arms to say that center is close to where it's close to the community, and they were not informed about the center itself.
Thank you.
Good afternoon, Commission after that. Just with regards to a truck protest that we've been unfolding this week, we spoke about taxi violence. Last year we were on the panel with regards to the task team to attend to the resurgence of trucks being vandalized and torched. What work has the committee done so far as we're seeing that same violence come up again and affecting our economy where we need trucks to deliver the important relevant medication across the province?
Thank you. I know what the panel to respond, and then we take from the ENCA, SAPC, and their colleagues asking Bill.
Thanks, Mr. Mabaso, and once again, thank you, colleagues, for questions. I think I will take others and leave those that are health related to the MEC. With regard to taxis ferrying 100% capacity of passengers, we are noting that and we are in touch with them. We're going to continue engaging with them and try to ensure that we adhere to the regulations. It is not going to be accepted that we risk with the lives of our people. So we will be working with them to ensure we will be not working but engaging them on that. It is important, and the MEC has already started doing some things in engaging them. With regard to social development, the report is with us. We are studying it, and we will sooner be communicating an implementation plan on taking the report of social development forward. In a week or two, we are going to definitely release it. As I can say, the Treasury has concluded the report, handed over to myself and the MEC, and we are processing it. Soon we will be implementing. Sheila, it is true. The minister have indicated and warned all of us, Minister Mkhize, that we are now hitting the storm. We are in the storm, confronted by the storm right now. It is going to last. Projection is that the period we are in right now, perhaps up until the end of August, might be the difficult one in relation to this pandemic. Are we going to review? And yes, we are going to be strict. But we will be guided by the national. The president is going to address the nation later today. And from that address, we will be developing strict measures from what is existing. And it will then depend on what is added, if there will be any addition from the address by the president this evening. So we are going to be strict. And that's why we are now sending also a message that all of us must play our role. Each and every one of us, it starts with you, myself, all members of the community. We must follow regulations as they are. Well, I'm sure the issue of the protest, Itendale and Mahatma Gandhi, MEC will deal with that. With regard to the issue of Mkungundlovu and finances, I must just say generally, the issue of municipalities is of course important. But in this case, the intervention is driven from the province. Hospitals are managed provincially and nationally, and not that the municipalities, unless it is municipal clinics and all of that. So the issue, it might not have that impact because the district has to provide what it has to deal with all other issues. But with regard to the intervention directed at public health facilities, it is the task of the health department. With regard to education, yes, there were PPEs that were reported missing. The department launched the investigation. When the investigation started, then the PPEs were reported that they've resurfaced. We said, no, let that investigation continue, even to check that what was the cause of that disappearance for that particular time. Had we not started an investigation, maybe those PPEs would have not been recovered again. So we are investigating that. I'm hoping that soon they will give us a report and we might be in a position to release everything together with the one of social development. The taxi industry is affected. We are working to address that. We are in touch with the national ministers. The national ministers who are working on this matter is in a main should be labor. Secondly, transport. And thirdly, police. But issues of grievance should be handled by labor. But we have a task team that we have established in the province, led by Economic Development MEC, MEC Nomsa Dubengube with MEC Begintuli, and they are working to deal with this situation. We are working on it and we will keep giving the report on the matter. Thank you. Let me allow the MEC to come and respond to the issue.
Good afternoon, ladies and gentlemen. Good afternoon, Premier, HOD for Health, and to you, colleagues. Let me start with the question on whether we are testing enough in KwaZulu-Natal. We believe we are testing enough as a province of KwaZulu-Natal. As the Premier indicated earlier on, we are the third highest province in the country that is testing. And for every 100 people, and out of the number of people that we test, our positivity rate is about 4%. Now, the numbers that we have are in line with the testing that we are actually conducting. You will find that there are other provinces that are way ahead of us in terms of the infected cases, but have tested less than us. So it's not a reflection on the number of people that we are testing or not. I also want to indicate that when we, as a country, started seeing a surge in the Western Cape and we were starting to have challenges with NHLS, the minister decided to prioritize Western Cape and made sure that all the required kits that were needed, should the majority of them be sent to Western Cape. So that's why you would find that from time to time, we will have a challenge, the rest of the other provinces. But Western Cape at that point had to be prioritized because, correctly so, they had more numbers of people that were infected. So I'm just saying this to add to my point, but we don't have these numbers because we are not testing. We are testing and we believe we are testing enough, and we are testing at a rate that we should be testing. In our case, I must indicate we had challenges with NHLS, which is our National Health Laboratory Services, a couple of weeks back. And with the engagement between ourselves, the Minister, and the NHLS, those challenges have been resolved. One of the biggest challenges was the fact that they were unable to find what is called a reagent. It's something that is used within the testing kit. And in the process of that, we then had to come back, all of us, into the drawing board and agree on a process of prioritizing our cases, and we agreed that your health workers are going to be prioritized, the patients that are in facilities become prioritized, contacts of a positive case are prioritized, then our community screening becomes our last. So that process has allowed us to unclog where the challenges were, and because of that, we've been able to reduce the waiting time for I think about a month back, we reported that we had a backlog of about 28,000 specimens, and we are now down to 3,000. So that process has really assisted us very much. The protests that are in the facilities, and I think I will just take all of them. Premier is quite correct. You find that some of the protests are protests that are relating to labor matters, that some of them are outstanding matters that have been there for quite a while. But because we now have this challenge of COVID, everyone will want to use the greatest advantage that they have, and this is still to be an advantage. And it is correct, we don't have a shortfall of PPEs right now in all our facilities. About a week back, we received a complaint that in one of our facilities, had run out of PPEs. And because I knew that we have the PPEs, I decided to go there myself and decided to actually go into our stores, and we do have enough PPEs. So we have found that sometimes PPEs have been utilized as a weapon to garner whatever other, or to fight for whatever other whatever other demand that is being put out there. Sometimes rightly, sometimes not, but we are finding it extremely difficult. And I think we should make a call to all our health workers to make sure that PPE, or the issue of PPE, is a very serious issue, and we should all take it very seriously, and we shouldn't abuse the fact that there was a challenge before. Let me also just indicate on the issue of PPEs and the infection rate generally. What we did as a Department of Health is that we provided protocols on who gets what kind of PPE according to the level of exposure that they are working at. That is the first point. And who gets tested amongst our health workers when there has been a case within a particular ward, and who and when and how do we disinfect the facilities. And we have made sure that we adhere to that to the T. The challenges that we have found over a duration of the past month or so is that while protocols are saying you only test people that are direct contacts of the person that has been infected, but if some of our health workers, they find that there has been one health worker in the whole facility and they all want to be tested. Now, that's not practical. Because in one facility or in one hospital, you'd find that we have more than 1,000 nurses, for instance. You have more than 1,000 enrolled nurses and so forth. So if we are going to be testing everyone, it's a waste of resources, it's a waste of time, and the likelihood is that none of those people would have been in contact with the person that had been infected. So that's why when there is a positive case, we make sure that we follow the trail of that particular health worker that is found to have been positive. Now, if a health worker, for example, works in a theater, and in that particular theater she is found to have been positive, the nurses that are working there are going to be tested, the doctors that are operational in that theater are going to be tested, the patients that were seen by that particular health worker are going to be tested, including your admin staff and your cleaning staff, if they have been in contact. But it's not possible that if just one theater, that staff was found to be positive, we then have to close all the theaters in a hospital. We are not going to do that. And we have been saying this, and we have been engaging with the organized labor, and we agree. When we have our own meetings, we do agree that it's not how it's done. We should follow protocols. The one thing that from our side as a Department of Health we have a responsibility of ensuring is that our managers at a facility level, they actually follow protocols to the T. And that is what we have wanted and made sure that it happens, so that you then decontaminate the area that is actually affected. Don't close down the whole hospital just because one area. However, if we find that there are infection in a far much bigger space within the hospital, and we are unable to link the infections or the infected cases, we then sometimes find ourselves having to close the facility for a few days and be able to follow up and then reopen a bit later on. I think you would remember that about 2 2 months back, we closed General Kizenga Hospital because we couldn't pick up and we couldn't establish where the virus had gone. Therefore, we had to close down and follow it properly and then reopen later. So it will happen from time to time where we are unable to follow the virus. And we are only sometimes unable to follow the virus when you find that a doctor in this ward is positive, a nurse in another ward, and a cleaner in a different ward are positive, and we can't see a link on whether they had worked together at any given time. We then become forced to close the whole facility. But you must remember that closing the whole facility in essence means our people who are supposed to be utilizing that service are not getting the service. So it's not a decision that we take very lightly. It's a decision we really have to be very clear about that. I also want to indicate that last week we did receive a complaint that some of the PPEs that have been provided to our health workers are of substandard, and we have then started an investigation, I think on Thursday. We've started, because the complaint we received on Wednesday. On Thursday, we started the investigation on which are those facilities and who are the service providers, because that's where we will have to come in and deal with those thoroughly. So we are working on that. But in the process of all of that, it becomes a serious worry again that our health workers, while they are complaining that a number of them have been infected, they also go out and congregate in groups and still infect each other continuously. Because once you go out and you stand around, you stand close to each other, then you are continuing you are allowing the virus to grow and the virus to keep on working. And we have found that it has been happening in a number of facilities, and that is our serious worry. While we allow and appreciate the right of all the workers to actually strike if they are not happy about certain issues, we believe we need to start using slightly different tactics right now because of the environment that we are operating in. It does not help that we are going to complain about a health worker that is infected today, but tomorrow all of us, we go to the door or to the gate and we stand with the same health worker, we shake hands, we sing together and all of that. Then that just perpetuates and increases the virus even further. So we are worried a little bit about that, and we are calling on our health workers to really take precautions. We have been talking to the organized labor about that particular issue. We are having another session with the head of department this coming week because of that. When you look at the numbers of infected health workers in Chief Albert Lutulo Hospital in particular, the day before they went on strike and 7 days later, numbers multiplied. And it's exactly what we said when we were in that interview, that because of how they had congregated, the virus is going to continue. And the numbers have greatly grown in that area. Having said that, we are not disputing that we also have a responsibility as a department to ensure that our health workers are not infected, but we also call on our health workers to help us so that we work together and we don't create an environment that's going to allow the virus to grow even further. I think Premier responded to Sheila about the issue of the regulations. In Dale, there are 22 health workers that are infected there, and they are given poor PPEs. We didn't receive a complaint from Edendale on poor PPE in particular, but we did receive a complaint from one of the facilities in eThekwini, and that is what we are investigating now, and we will continue to do so. 22 members that are infected who are health workers, we are quite worried about that, and I think we have been saying it, but we are calling on our health workers to also work with us to make sure that even when they are amongst themselves, they practice social distance, which we've not practiced in this room today, despite the fact that we've got enough space. We sit very close to each other. But even when they are amongst themselves as workers, they think a mask is only for when you are speaking to a patient or you are treating a patient. But remember, the infection and the virus right now is a virus that is community spread. So, and all of us, including our health workers, we live in communities. So you can't take it for granted that just because I know you or you are my friend, you don't have the virus. You can't take it for granted. You can't take it at that level. So it literally means wherever you are, you always have to have a mask on. You always have to sanitize. You always have to wash your hands, and you must always keep a social distance. And that is an issue that we are raising, and we want to make sure that our workers are keeping to. Mahatma Gandhi has reached capacity. It's probably very true, which is why in eThekwini we've created more beds. Mahatma Gandhi is not meant to keep all the COVID cases. Not just Mahatma Gandhi, the district hospitals that are in eThekwini are supposed to take their patients once they only keep the patients that are under investigation. Once a patient has been found to be positive and within their space, they are then supposed to transfer them to the higher level. That's why we've got new beds in Wentworth, we have new beds in Clearwood, we have a temporary structure or a temporary facility that we call a field hospital that we are creating, and it's probably going to be completed by the end of this week in Clearwood as well. So Mahatma Gandhi is not meant to keep COVID positive cases. Their only responsibility, because you can't run away from this, when a patient comes into a facility, you never know what they are sick of. They might be sick of something else, but you find that they are positive. So those we put on a separate ward that we call a PUI ward, meaning it's a patient under investigation. As soon as we find them to be positive, we then elevate them to a different level of care, so that the beds in Mahatma Gandhi and all these other hospitals are cleared up. So they should be able to follow their referral pattern, but HOD is here. I think is going to make sure that that is actually done, but they are supposed to be able to do that on their own. There's a question about the Chesterville COVID-19 center. Let me firstly indicate that our quarantine and isolation centers, first of all, for us to be able to put them up, we don't necessarily have to consult a community. Because if we did that, it literally meant even the hospitals that we have, we can't use because we would not have had an opportunity to consult the communities. Secondly, we appreciate and always call on the private sector and the NGOs to work with government in assisting us to establish these centers, because the nature of the virus meant that literally none of us had budgeted for it, and government doesn't even have enough funds to be able to put up all the beds that are needed. So all the offers that we are getting from the private sector, we appreciate and we really go with them. But I must indicate that the Chesterville Center was never reported to the Department of Health. That is why you would find right now that even if it's there, it only has beds. We don't know anything about it at this point. We only got to know about it when we received a question, I think it was yesterday. And before we put a facility like that, we do our own analysis as the Department of Health. How far is the community? Are there people able to get into that? Do they have access? Is there a need for us to put perimeters and all of that? So we don't just put up a facility in an area that we've not properly assessed and clinically looked at whether it will infect the communities or not. Remember, our understanding is that the virus is a droplet virus. I know that there's a debate right now that it could be airborne, but the official position is that it's droplet. And now, if it's droplet, it means it doesn't move through the air. Therefore, it's not often a problem to a community that is nearby, for as long as there is some space between the community and that facility. But I do want to indicate that the Chesterville Center, we are not aware of. We saw that they have put up beds. We are going now we started yesterday to try and get hold of the city, firstly, and when we spoke to the city, they indicated that they were approached by an NGO some time back, and the city said they needed to come to the Department of Health provincial office with the NGO. That engagement never happened. So we will follow up. And before this center is able to function, if it ever functions, we should go in as the Department of Health and conduct a proper assessment. So far, it's not a facility we are going to be utilizing, because all the facilities, including the facilities that are donated to us, are meant by people from the Department of Health. In other words, the doctors come from the Department of Health, the nurses, and so forth. So you don't just have a facility just because we have beds, then we call it a facility. So we do have quite a number of people who have donated some facilities to us. Premier spoke of the DPSA that is donating 150 pods. and those pods, well, we'll utilize them as 150 beds. And right now we are looking at one district that doesn't have one field hospital, and that's where we are going to take those. So we do accept donations, but it must be donations that are followed through properly so that we are able to assess the area and on all of that. But we will investigate this particular matter and be able to take it up. Thank you very much, Mabas.
I think Dr. KZN announced 2,000. What is the allocation of KZN on this?
All right. The issue of the ventilators, I think for the past 4 weeks we've been responding to the same question, but it's fine. We'll continue to respond to it. Currently, we have 460 ventilators in the province of KwaZulu-Natal. Those are in different hospitals and are being utilized there. As I indicated, I think about a week or so back, we have also created capacity in our new facilities where if it's necessary for us to put a ventilator, we'll be able to convert those beds and we'll be able to put ventilators in them. So right now, they are new beds, they are ICU beds, but if we needed ventilators, we can actually put a ventilator and they'll be able to be utilized. Now, remember, I said we have 450 ventilators in the province. However, in terms of people that are in ICU and are being ventilated currently, as a province, we've got about 45 people that we have ventilated, and I said we have 450. So in terms of capacity, right now we still don't have a challenge when it comes to ventilators. The minister, yes, has announced that we have received, or the South Africa has received a donation. I think we are going to be told in the next day or two what is the allocation of the province of KwaZulu-Natal in that allocation, and as soon as we have received that, we'll be able to indicate. But you must also remember that last week when the same question was asked, I indicated that we had been promised a donation of about 100 ventilators that we are still waiting for, and those have not arrived. I'm assuming that the donation that the minister was speaking to yesterday might also contribute to that particular donation. Thanks, Bamas.
The SABC wants to go. Okay, let me just finish this one. The SABC would like to know whether, in view of the increasing number of infections in the province, does the Provincial Command Council believe that we're still able to contain the spread under level 3? There's one question from the SABC. Let me take you the very last one.
Okay, no, this is just a follow-up, Premier. There is a perception in public that we're just living in a province of impunity, and what people are presenting as clear examples of that is that while under level 5 we have street vendors being arrested for selling, taxi operators are continuing. So can you just get clarity as to why they've been allowed to flout lockdown regulations? And two, if indeed health workers, MEC, are breaking the law or are behaving irresponsibly by engaging in protest action, which then affects operations at health institutions, why aren't we seeing then those matters being dealt with through the right means? Thank you.
Let me start by indicating that South Africa is a constitutional state, and everyone has a right to protest if they are not happy, especially under their work environment. However, there are regulations, and like Premier correctly indicated, all the protest actions that we saw last week were all illegal. That is why I indicated earlier on that we started having engagements, individual engagement with the different unions, and we are meeting with them on Monday because we need to actually deal with this matter once and for all. However, there are areas where in reality it's clear that the department needs to take actions against certain people, and that because it's a labor matter, it is something that is being followed, and we are following the processes that we need to follow on those particular instances. I mean, an example of what the Premier was talking about, that there are issues that are not COVID related. In one facility in Umgungundlovu, when we had added, in fact in Northdale, where we had added the new enrolled nurses, the new professional nurses, admin clerk, and the orderlies. Some union leaders in that facility decided that they are going to just be a law unto themselves and chase away everyone that had been fired because they don't know how those people had been employed. Sorry, yeah. So they wanted to get everyone out of the facility. Now that's something we're not going to tolerate. That's something that we are just not going to tolerate, because it has absolutely nothing to do with the work that is supposed to be done. And what is mostly frustrating is that it actually it's reducing the capacity that we are trying to increase in those facilities. So we are not going to tolerate that, and we will be following proper processes in relation to that. That's just one example in one facility. So each and every facility, it's not all the same. There are different circumstances, and we are dealing with them individually so that we don't lump all the issues together. Thanks.
Thank you. Let me start on this issue. You unfortunately ask a question about something that is happening nationally, and you want to make it an KwaZulu-Natal issue. The issue of taxis faring to a full capacity is not a KwaZulu-Natal issue, and it has been handled by the Minister nationally. Minister Fikile Mbalula has been engaging with the Taxi Association. In complementing those efforts by the Minister, we are then engaging with them at a provincial level to find each other and have a common understanding. Now, I don't believe that you can then take that as the issue of KwaZulu-Natal alone. However, we have to deal with the matter. People who are selling on the street were dealt with at some point, but taxis were dealt with at some point. We were all out in roadblocks around eThekwini and various parts of this province during the same period. Now, your comparison seems to be not factual in this regard. And once we take a decision that says let us enforce from national, we will take that approach. But we've taken a decision to engage, as Minister Mbalula said, and easy, meaning he was not prepared to engage with them toe for toe in a confrontation, but was only calling for an internal engagement and resolving the problem internally through amicable ways. So if we take a different approach, that approach will be undermining the national intervention. And the intervention that has been started so far has been that of engagement, and we are also complementing it. I think that was the question, but SAPC, I'm not sure whether it's SAPC, they've asked whether if we think we are still in charge, and given the situation, is alert level 3 still the applicable one, or we need to go back. We are going to be guided by both the scientific analysis, but also by what is happening at a national level. We are going to be strict as the Command Council. We're not going to allow funerals to be attended by many people without preserving the regulations. We're not going to accept ceremonies such as weddings, parties, events, and all of that. No. Even ourselves, we have cautioned against that, and we are saying meetings should be scaled down. And if people are meeting, let them meet virtually. It should only be those meetings that are clearly accommodated within the guidelines that should take place. So we are going to be enforcing, but we will follow the line from the national. Siyafisa ukubonga ithuba lokuthi sinikezele i-update kubantu bonke bakwaZulu-Natal ngesimo sale sifo esibhekene naso se-coronavirus okuyisifo esiwubhubhane ukhuvethe sonke ekudinga sibambisane ekulweni naso. Siyafuna ukubonga kwabezindaba ngendlela abasebenza ngayo besixhumanisa nomphakathi, and siyazi ukuthi kwabona isimo somnotho arising from i-lockdown ses-affecte abaningi kwabezindaba. Yingakho-ke sithi kubalulekile ukuthi sisonkana sibambisane ekulweni nalesi simo esibhekene naso ngokwezempilo nangokwezenhlalakahle nangokomnotho. Siyafisa futhi ukudlulisa ukubonga kubasebenzi, especially amalunga e-Provincial Command Council nabasebenzi abasebenzayo ukulekelela i-Provincial Command Council ngolwazi nobuchwepheshe nakho konke ekutheni sikwazi ukunikezela ubuholi obuyikho. Isonto elidlule yisonto la sivela khona ezimeni ezithe ukusithusa. Siyafisa ukuzwelana nendlunkulu yonke yakwaZulu ngokudlula emhlabeni kukaQueen noloyiso Sandile esaziyo ukuthi becacele ebukhosini e-Eastern Cape oyindodakazi yenkosi uCypriel kaDinizulu kanti futhi ongudadewabo kaBayede ingonyama yamaZulu. Siyafisa ukuthi sizwakalise futhi ukuzwelana nayo yonke imindeni ethe yalahlekelwa izihlobo zalo kulona leli sonto esikulo ngenxa yezifo ezifana related kwi-Covid19. Uhulumeni silahlekelwe yilunga lesishamthetho umfowethu uRicardo Mthembu nobe ngumkhulumeli we-African National Congress. Nakubona umndeni wakaMthembu nakubaholi be-ANC bebonkana siyafisa ukudlulisa amazwi enduduzo. Njengamanje kuyacaca ukuthi ubhubhane lwe-Covid19 selufike la esesithi khona sikwistorm okusho ukuthi singathi isibambene akusekho kunye akukho ukuhlehlela emumva. Kumele sonke sikwazi ukuthi sivikele nabathandiweyo bethu njengoba bekuprojectiwe. Njengamanje sesiriche i-level ye-peak la esesithi khona izinga lalesifo selifinyelele phezulu futhi lisazoqhubeka for inyanga eyingaba 2 kusukela manje. Sibonile-ke ukuthi la KwaZulu-Natal ibalo ezabantu esebetheleleke ngalesifo sezicela ku-23,751 ngokunjalo esebesishiyile ba-1,082. Lokhu kusitshena ukuthi kuleli sonto nje elilodwa esivela kulo abe maningi kakhulu ama-cases arekhodiwe asithathe asibeka kule number esikuyo. It means ukuthi kwisonto elilodwa sibone ama-cases aba-9,767. Almost wonke ama-district aba nama-cases close to 100 or more usuku nosuku, with the exception of i-case i-district efana nomkhanyakude. iTheku lisalida lilandelwa uMgungundlovu neKwaDukuza kumbe iLembe district iyonkana. Ngokwezibalo njengamanje ibalo zama cases wonke zingu 23,751. Siyafisa ukunikezela isiqinisekiso sithi imbhede esiyilungisile engu 7,111 iredi isekhona, kodwa siyaqhubeka sizama ukueda njengoba nje sikhulumisana neDevelopment Bank of South Africa ukuthola eminye imbhede. Ngokunjalo sikhulumisana nenhlangano kumbe nalabo abakwi-hospitality industry ukuthi balekelele nabo ngaba ngakwazi ukulekelela ngakho. Singasho ukuthi lezi ibalo yakhombisa ukuthi sesikwi-peak enkulu, and therefore sonke kumele sithathe irresponsibility. Yingakho sithi imicimbi kungaba imishado, imingcwabo nanoma yini, kumele siqinisekise ukuthi imigomo yokuzivikela ibekiwe. Ubumnandi bakithi abupheli nangale kwe-Covid19 ezodlula iyothi misikahle abantu bakwazi ukuzijabulisa. Siyafuna futhi ukuphawula ngodaba lokuthi indawo eziningi zezibhedlela sibona iteleka. Siyafisa ukuthi abantu bakithi bazi ukuthi uhulumeni uzama konke okusemandleni ukuvikela abahlengikazi nodokotela nabasebenzi, kodwa kuba kubi uma kuzosetshenziswa ezinye izinto eziseceleni ukuthi kugqugquzelwe abasebenzi ukuthi bangene esitelekeni, kube izinto okukhalwa ngazo zilungiswa ngaleso sikhathi. Ngokwe-screening sibonile la KwaZulu-Natal sesiscreene abantu abangaphezulu kuka-7 million, okukhombisayo ukuthi iprocess yokuscreena ihamba kahle kakhulu. Sithi-ke sisonke asibambe iqhaza. Kuwo wonke umuntu umuzizwa ungaphilile, hlala ekhaya. Ungaphumi ungaphilile, uyithole uphumela emphakathini. Zigcina kumbe asigcine i-social distancing, sishiyelane ibanga elingacela ku-2 meters la sihlangene khona, kodwa senze konke okusemandleni ukuthi ukuhlangana kwethu sibe baningi siyakunciphisa. Masugeze izandla ikhathi nezikhathi noma sisebenzise isanitizer efanele, sigweme ukuba baningi endaweni eyodwa. If kungukuthi utesta positive, siyacela ukuthi wazise umqashi wakho nabaseduze ukuze sikwazi ukuvikela bonke abantu, nendlela esiyiphatha ngayo ngaleso sikhathi ikwazi ukuvikela abathandiweyo bethu. Sibonile izehlakalo zodlame emateksini, especially la kudutshulwa khona amatekisi endaweni yaseNanda kuya eNdwedwe, kudutshulwa amatekisi la kudutshulwa amatekisi anabantu ababagibeli nje. Lokhu kusiphatha kabi kakhulu ngoba kuveza ukuphela kobuntu, kuveza futhi ukuthi lemboni ineyinkinga okudinga sibe seduze kuzo ukuze zixazululwe. Ingakho ku-MEC Ntuli eseqalile ukuthi abeseduze uku-investigator namaphoyisa zonke lezi igameko ezenzekile, in particular lezi ezenzeke izolo. Ngalawo mazwi siyazwelana nabo bonke abathe balahlekelwa izimpilo zabo nabathe balimala, sibafisela ukululama okuphuthumayo. Emphakathini wonke waKwaZulu-Natal siyafisa ukucela ukuthi masigweme ukuthi sitheleleke ngokulandela imigomo ebekiwe. Mas-observe i-social distance, okusho ukuthi ukushiyelana ngebanga naloyo muntu omlandelayo, ngaba isesitolo nomaphi. Masigweme ukuthi siphume siye ngaphandle emphakathini singawafakile ama-mask. Masiqinisekise ukuthi siwasha izandla isikhathi nesikhathi. Ngifisa-ke ukuthatha leli thuba ngifisele nozakwethu njengondunankulu waseGauteng, undunankulu wase-Northwest nowase-Western Cape, okuzwakela ukuthi nabo sebethelelekile ngalesifo. Sibafisela nabantu bonke base South Africa ukululama okuphuthumayo. Sisonke masibamsane ekulwisaneni nasekunqobeni lolu bhubhane lokhuvethe lwe-COVID-19. Siyabonga.
Thank you very much, Premier. I just want to confirm to her, if it was cited in her question, the question has been answered broadly as part of the response by the minister around the healthcare facilities and the cleaner around the infection and health worker. On the specific hospital, the question to be answered directly, I think there's engagement between the department and her. Thank you very much.
Yes, we are not suspecting your question. Thank you very much, everyone, and MEC and colleagues. With that, we adjourn to the
Provincial